What non-invasive bladder treatment options exist for mild symptoms? When it comes to managing mild bladder symptoms, many people may wonder what options are available that do not involve invasive procedures. Fortunately, there are several non-invasive treatments that can help improve bladder health, particularly for conditions like overactive bladder or mild urinary incontinence. Let's explore these options in detail. First, behavioral therapies are often the first step in treatment. These include bladder training, which involves gradually increasing the time between urinations to help improve control. Scheduled voiding is another technique where you go to the bathroom at set times to prevent sudden urges. Additionally, managing your fluid intake and diet can be beneficial. Reducing irritants such as caffeine, alcohol, and spicy foods can lead to significant improvements. Weight management is also crucial, as excess weight can worsen bladder symptoms. Another effective non-invasive option is pelvic floor muscle training, commonly known as Kegel exercises. These exercises strengthen the pelvic floor muscles, which support the bladder and urethra. By regularly contracting and relaxing these muscles, you can enhance bladder control, especially for stress urinary incontinence. Lifestyle modifications play a key role as well. Avoiding bladder irritants, managing fluid intake, and quitting smoking can all contribute to better bladder health. Maintaining regular bowel habits is also important, as constipation can exacerbate bladder issues. For those whose mild symptoms are not adequately managed through behavioral methods, medications may be considered. Anticholinergics are one class of medications that help calm bladder muscle overactivity. However, they can have side effects like dry mouth or constipation. Another option is mirabegron, a beta-3 adrenergic agonist that relaxes the bladder muscle and can improve storage capacity with fewer side effects. While not strictly non-invasive, some minimally invasive interventions may be considered if symptoms progress. For example, sacral nerve stimulation involves implanting a device that sends mild electrical pulses to the nerves controlling the bladder. This treatment is generally reserved for more severe cases but is less invasive than traditional surgery. Botox injections into the bladder muscle can also be used for overactive bladder when other treatments fail, although these requiring periodic repetition and come with risks. It is essential to avoid unproven or risky treatments that lack scientific support. Relying on evidence-based therapies ensures safety and effectiveness. In the context of bladder health and bladder cancer, non-invasive treatments primarily focus on managing symptoms and enhancing quality of life. If you experience mild bladder symptoms, starting with behavioral and lifestyle approaches is advisable. Always consult a healthcare professional for personalized advice and to rule out any serious conditions, such as bladder cancer or infections. Non-invasive options are safe and effective for steps for managing mild bladder symptoms and maintaining overall bladder health.